Hi, I'm Ahava Leibtag. Today I am joined by my very smart and new friend, Kalee Hildreth, Executive Director, Marketing Operations at UChicago Medicine, to talk about digital transformation. You've got questions, we've got answers. Let's get into it. Welcome, Kalee. So wonderful to have you here.
Hi, thank you so much for having me. I'm very excited about this.
I met Kalee in Las Vegas at HCIC. We started talking about makeup at one of the roulette tables or the craps tables. It was
Yeah.
and instantly became friends. I also saw her give this fantastic presentation at HCIC and was just blown away. We need more women like you in our space, Kalee. So thank you for
Thank
being
you.
here. What are you most excited about? You know, you and I are recording this at the end of December of 2025. What are you thinking about for 2026?
I am frankly most excited for the work that we're doing in the AI space. We are doing quite a bit, but first I'll start with we're working on building out first an assistant, and then it's going to become truly agentic for scheduling on our website. And it's been a lot of fun. It's been very complex as well. Really, really interesting to learn all of the nuances of how it can react to patient inquiries or non-patient inquiries as well and formulate good responses that actually respond to the intent based on our website content. And so we're going to pilot that early in 2026. And then immediately, we've already started building on that use case to allow for escalation to our access center agents, which I think a lot of people will respond well to because you're not then waiting on a call and sitting on hold for your answer. You've gotten as close as you could to the answer you need, but then we are there to not tell you, sorry, go ahead and give us a call. We're going to go ahead and do that for you and continue the conversation because no one gets more frustrated than when they have to repeat the entire interaction with a bot to an agent. With that, we are also working toward online scheduling. And I think that is going to really be where a lot of the value we find is. People are not necessarily coming to our website just dying to click around. They are coming there with intent. And what's really interesting now that we're seeing is we're getting so many people dropping off from the AI results and not clicking through, but those who are clicking through are very high intent. And we need to serve them as quickly as possible because we know that they're a little bit further along technologically advanced. So they're very capable of and comfortable with using things like our agent.
That makes a lot of sense. And it's also what we're seeing, I think, in traffic in general, that the funnel has shrunk at the top. But if they're coming to your site, they're ready. They have high intent to schedule or make an inquiry. I want to go back to what you said. It's so fascinating because you said it was a complex process to put together. One of the things that we hear is that doctors are very concerned about the chatbots. They don't want the wrong medical information, which always makes me laugh because it's like anybody who works at a hospital doesn't want the wrong information to get out.
Right.
Dr. Smith, like you don't have to worry about that.
We all want the same thing.
Exactly. But the agentic AI and then the triaging to potentially a medical professional or the call center, which is really trained to handle these things. Did you find that those conversations with clinicians, was it helpful that you were able to say, we're going to know when this person can stop talking to this chatbot or needs to stop talking to this chatbot and goes to human intervention? Or was that not a concern of theirs at all?
Absolutely a concern. And the way that we addressed it was creating all of these different scenarios that sort of create like trigger words or trigger phrases or concepts that are immediately going to escalate to an agent. And so we're going to keep very close eye on that right after launch and see what and when those are being triggered so that we're getting it right. We're not triggering too early and we're not missing those opportunities as well. But in terms of diagnostic information within our bot, that was a huge discussion for quite some time. We looked at multiple pathways to using a diagnostic engagement and ultimately decided we just weren't comfortable with it and instead focused on sharing the same information that is readily available on our website to answer those questions. So very neutral, very factual. And we also, of course, have many disclaimers letting people know that we cannot diagnose and they need to speak to a medical professional.
No, that makes a lot of
Legal,
sense.
legal loves that.
So what you're describing is the huge holy grail in healthcare marketing that I haven't seen happen in 20 years. It almost sounds like we're really getting close with agentic AI, is that you'll have end-to-end attribution. Like you can really
Yes.
show we pulled this person from here. They came to our chatbot or whatever. They were able to make an appointment. How do you think that's going to revolutionize our jobs? Because I feel like it's always prove your worth. What have you done for me lately? Do you think that having that data will certainly open up the faucet for budgeting, or are you still concerned that they still don't get it?
No, I mean, that's such a great question because for us, it already has opened up so much. We've spent the past 2 years very rigorously working with IT and with finance, building out a true attribution model that isn't just this person completed a form. Now we can see that they have actually scheduled an appointment. We know the financial value of that appointment. And then we also are able to attribute whether or not these patients came from marketing. And then within that same space, we also have our control groups so that we can show true lift. Because the first question you're always going to get is, how do you know they weren't going to come anyway? And so that actually has been it's like a really tough metric because you're like, dang it, the control also came here. But that's actually not a bad thing because then you can know, hey, this wasn't actually as valuable as we thought in terms of initiative. Let's focus our energy elsewhere. And it's also helped us get marketing viewed really as not a cost center. And I know a lot of marketing teams say that that's the dream, but right now we're doing such a great job partnering and showing our value and feeling more like a team player at the table, not sort of like the end space after all the conversations have been had. And that I think has raised our profile and it's also raised our success rate. And it's also brought us closer to the institutional values and what the objectives are for the larger institution.
That's amazing. But what the one thing I wanted to say about the whole, like, how did the lift question is, I always say when people push me on that is if you learn to measure brand, you will be a zillionaire. No one has really ever
I love that.
So that's my response to them. Like, how do you know they wouldn't have come here anyway? I know that they came here because they saw us somewhere. They heard about us the 9,000 times we peppered them on social. There are reasons why they're here. It's always so funny
Right.
when executives, especially the finance pros, ask that question. I'm like, why are you wearing that suit? Why did you pick that?
Right. I mean, it's always hard sell to say, well, marketing is multi-experiential, multi-touch point, and we're doing our best to identify which one of those touch points brought in a patient. But at the end of the day, a new patient is here. Let's keep them. Let's give them great care.
Exactly. Fantastic. I love that. You said something really interesting about all the legal and compliance and the building the end-to-end attribution and having to involve all these people. And so you're part of the Center for Digital Transformation at UChicago Medicine. Mm-hmm. And when you go to their website, they have very clear, these are the things that we're focused on. These are our pillars. And one of the things they talk about with ethics and governance when it comes to innovation is we envelop all that we do with appropriate governance to ensure ethical development and deployment of digital solutions. Yesterday, Texas sued Epic for having a monopoly, some other privacy issues. I think we're going to see more and more of this. So what are you thinking about as we walk into 2026 about these issues? Because it's very clear just in the short conversation we've had, it's humming in the background all the time. How are we taking care of patients as ethically as we can, but also how are we advancing technology to help them? And anytime you change things, yes, it's possible that mistakes will get made. So talk about a little bit about how you guys embrace that.
Yeah, it's just a baseline for AI within ethics specifically. Everyone should bring into that. How do you want to be treated? How do you want your mother to be treated? And use that as the baseline for your decision making. We're all so excited to move forward so quickly with what we can do, but we really need to consider the experience of the individual. And for us, that individual is not just the patient, it's also our staff, and it's also the healthcare industry at large, investing in other AI tools that can advance healthcare for the future as well. And within all of those spaces, we have an AI governance group that helps us with our decision making, with vetting from a multitude of perspectives. Of course, compliance, privacy, and security and legal are all there, which we need them to be, because without their blessing, we can't move forward. But with that, in our AI group, there is an entire subcommittee just purely dedicated to ethics and making sure that what we're doing is in the best interest of who we're doing it for. And so it's baked in before, during, and after. And ethics is not something that you can just do, launch, and be good with. It has to be something that you continue to invest in. So when we do launch our agent, we're going to be looking at the types of answers that we're giving out
Of
and
course,
making
yeah.
sure that they fall in line with those ethics. And we're really treating people, like I said, how you'd want your mom to be treated.
So it's really interesting that you say that. Can I push on that a little bit? Because I've been in these
Please.
conversations. Okay, so here's what happens in the conversations that I'm in. The conversations go like this. I got a mammogram result that said that I had a lump in my breast. I get escalated through the system. They call me to make an appointment to see a breast surgeon or whoever it is at the hospital. I love that. I want that because I'm a 50-year-old woman with 3 children and a full-time job. And I would love that. That would be amazing. Like automate my whole life. But a lot of other people would say, I don't want my mother treated like that. I don't want to be treated like that. We put personas into early adopters and late stage adopters and all that. When you're sitting there and you're talking about this stuff, how do you determine where the line is that you won't cross? How do you gate it so that the people who really want it can have it and the people who don't? Is there a way to do that yet?
Absolutely. We focus on omni-channel, and I know that phrase gets thrown out a lot, but how we define it is meeting the patient where they are and on what platform they choose. So we want to create a very consistent experience across someone calling into our access center, someone sending a MyChart message to their doctor, someone coming to our website and using the bot, or even just using our search tool. And so making sure that you have a similar continuous experience for the patient through any direction that they start, because they can, of course, switch channels at any time. So they do need that continuity. And so making sure that each channel is optimized for that individual user's experience is really critical. We want to move forward with AI and technology, but we still have to serve the people who don't want it.
Yes, that's a great answer. I love that because meeting people where they are, it means so many things to so many different people.
It
And you
does.
need the person in the room to say, let's think about the not lowest common denominator, because I would not say it like that. Person who's the most anti this, all the way to like the Ahavas of the world who are like, please manage my life for
Give me more.
just
Right.
tell me what to do and when to do it. We had talked about this in the pre-interview, but I want to talk about digital transformation and what that means, because at HCIC, you heard those 2 words being thrown around. If I had a quarter for everything, I would have walked out of that casino with a lot of money.
That's true.
What do you think digital transformation really means? What does it mean within a healthcare setting? And then what does it mean at UChicago Medicine?
Digital transformation is so broad. It's kind of like omni-channel, actually, where
Right.
a lot of people just apply what they want their own answer to be. Like, you can only transform what you can transform.
Right.
And so for us, and I think really broadly, we've moved away from the concept of the digital front door, which focuses solely on your website, on your search results, on your location listings, on your ratings and reviews. Those are all very critical, but transformation has to be fully experiential. We cannot stop our digital transformation the second somebody clicks a button to schedule their appointment. Operations has to fall in line as well. And I feel like we're finally at the point in which we have some great operations leaders who understand that, who want to live that, and who really want to make sure that we're putting systems in place for that continuity of experience.
That's awesome. I'm excited also just because I think that for me, a lot from the content and content operations perspective, AI is changing everything. And what we're finding out is it's even more important than ever that you speak about your brand, that you connect with an audience, that you're authentic, no matter what the experience is. And it's not just digital transformation, it's organizational transformation. It's
Absolutely.
how are we going to represent ourselves through these screens in the way that we want people to know us and feel like they want to get care from us? And it's not just about the tools that we're using, it's really about maintaining the humanity in the tools. I hope you're an inspiration to everybody watching, just like you were to me.
So much fun work, though. That's what I love about it. I've had my whole career in healthcare digital marketing, and this has always been where we've talked about getting, where we've always wanted to be. And I'm just like so thankful to get to work on projects that are this interesting and this impactful. And the passion at UChicago is really high for this work, and it just builds upon each other. And that sort of enthusiasm for delivering something that is good for the patient, I think, has been really infectious, but also makes the work we do better.
Yes. So you are articulating what I always tell people when they talk about what do you hire for? And I always tell people the number one thing I hire for is curiosity. If you are a
Yes.
curious person, you will keep going at a problem or
Exactly.
you solve it. If you're not a naturally curious person, you could be talented in other areas.
Absolutely.
Marketing probably is not for you.
Probably not. Probably journalism also is not.
Exactly, exactly. Kalee, thank you so much for being here with me today. This was a great
Thank you
interview.
for having me.
Thanks to our viewers for joining in. I hope you got the answer you needed today. If you did not, please leave a comment below or email me at ahava.leibtag@ahamediagroup.com.